Hey everybody, this is Dr. Nick with the Springfield Wellness Center. This week we're going to be talking about sciatica or sciatic pain. Sciatica is a complicated issue that a lot of people suffer from. There's a few different types of things that can cause sciatic pain. I always tell people that sciatica is not really a diagnosis or a cause, but more of a symptom. And it's because other things are what are causing the problem, and then the sciatica just happens to be how you feel. So first let's talk about what actually makes up the sciatic nerve, and then we'll talk about what can cause pressure on it, and then what we can do about it. So the first thing is, what is the sciatic nerve? So the sciatic nerve is a compilation of the 5 lowest lumbar nerves. They come out from the spine, they form one nerve right above the hip, and then they run down the leg. Now, anywhere where that nerve gets pressed is going to create the sciatic symptoms. So if you have any problems here at the spine, whether it be a vertebra being out of alignment and pressing on the nerve, or a disc bulge that's pushing back against the nerve, that's going to create symptoms wherever the nerve runs to. So that'll run down into the leg, and depending on how low the nerve is that's being irritated, down into the foot. Now there's a couple of other areas. Anywhere else that the sciatic nerve gets irritated, it's going to create those symptoms beyond that point. So another area, probably the biggest area beyond the spine that causes sciatic problems is the piriformis muscle. So the piriformis muscle creates external rotation of the hip, so it takes your hip out like this. And when that becomes shortened, it's a muscle that runs sideways across your buttock. And when that becomes shortened, it gets tight. Now the sciatic nerve runs either right behind the muscle, or in some unlucky people runs actually through the belly of the muscle. If that gets tight, it'll press on that nerve, and that creates the symptoms of the sciatic pain. So if we focus on the low back, when the problem is really coming from the piriformis muscle, we're not going to get as much relief as we would hope for. So the 3 areas that we really like to focus on here in the office whenever we're dealing with sciatic pain is, first we need to isolate what is the actual problem, and then go from there in terms of treatment. So the first thing that we look at is the spine. We're looking to see if there are any vertebrae that are out of alignment that might be pressing on a nerve that goes into the sciatic nerve. We're also going to look at any disc issues. So if there's any kind of disc bulge or rupture that's pressing on one of these lumbar nerves, that's going to create sciatic pain. And then also, if we don't find anything at the spinal level, we'll be looking at the piriformis muscle and the hips to make sure that those are in alignment. And then we're going to do 3 things here on the video today. First is we're going to talk about how we do the adjustment to the low back. Second is the decompression table. And then third is going to be a stretch that we do here in the office that you can also do at home to help relieve that tension in the piriformis muscle. So we're going to head over into the adjusting room and get started. So after doing a full exam, we'll be able to determine whether the problem's coming from the spine itself, from a disc bulge, or from the piriformis muscle. So the muscle that we were talking about earlier is that piriformis muscle, and it runs right here along the buttock. So first we're going to talk about how we address the spine. So when we do our chiropractic exam, we're going to be palpating to determine whether there's any kind of misalignments or any areas that are not moving the way that they should. If those misalignments are pressing on the nerve, then that can create a sciatic problem. So I'm going to have Pat lay on his right side here. That was to show you how we do a lumbar adjustment in the office, and that would help take pressure off that nerve. So we get him in position here. We find our contact on the vertebra that's out of alignment, and then it's a gentle adjustment on the low back. With the disc, we're going to need to do orthopedic tests to determine if there is any sort of disc bulge or herniation, which we would have already done with Pat. And then we're going to go into the PT area and show you how the decompression table works when we're dealing with discs themselves.
Extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center, discussing with you things you can do to help prevent sciatica. Sciatica is a real pain in the butt, literally, because most often people's symptoms appear there and often have radiating pain down their leg. If that's happening to you, there's probably things that are going to need to be done to help you or to figure out your immediate pain relief. Once you've figured that out, there are certain exercises you can do to hopefully prevent recurrence. We want to have or need to have a strong lumbar support and good spinal stabilization to hopefully prevent the irritation of the sciatica from recurring. So I'm going to show you 3 exercises today that you can do. We're going to start out with things that are gentle and moving the right areas of the lumbar area, and then we're going to add more challenging mobilization to help strengthen that area. So the first one we're going to do down on the mat. Pelvic tilts are a great thing that anybody can do, but certainly if you're experiencing low back pain or sciatica. You'll want to recline and have your feet flat on the floor. We'll want to, it's just a very minor move. You'll want to pull the belly button into the spine and flatten out your lower back. It's hard to even see if you're if somebody's watching, if you're doing anything, but you're going to do a pelvic tilt 10 times where you pull the belly button into the spine. You'll feel a nice stretch in the lower back, and then release that, coming back to a neutral spine. And again, you can do that up to 10 times, maybe 2 or 3 sets if it feels good, is probably a good amount to do. And then if you're tolerating that well, you could go into a more challenging exercise where we're going to tilt the pelvis, have that lower back onto the floor, and then we're going to bring our feet up and do very small reverse crunches to then engage more muscles and strengthen the lower abdominals, which is going to provide some lumbar support. And again, do maybe 2 to 3 sets of 10 of reverse, very small range of motion reverse crunches so that we don't aggravate the lower back. So we start in pelvic tilts and then progress to reverse crunches. The second thing we're going to do is help strengthen the oblique muscles, and we're going to again keep our feet, have our knees bent, but have our feet together this time, our knees together, have your arms out in a cross position, and we're going to lower the knees to the left and to the right in a reclined twist with our feet on the floor. It's going to help warm up our lower back. It's going to help stretch our obliques and help mobilize that area. And again, do that 10 times. If that's well tolerated, you can progress into a strengthening move where you actually take the feet off the floor and twist left to right, only as far as your back tolerates to your level of stretch. It doesn't have to be all the way to the floor, but enough to feel a stretch and then a strengthen as you twist. And again, if that's tolerated, you can continue those maybe up to 10 reps with 2 to 3 sets of 10 reps. And then the third exercise we're going to do is a bird dog stabilizing exercise on all fours. You'll want to have your wrists under shoulders, knees under hips, in a nice squared up position. Neutral spine is always where we want to start with a bird dog. But then we're going to add an arm and leg extension, opposite arm and leg extension, and reach through the fingers, reach through the heel. It's going to be activating muscles that are going to help stabilize our lumbar spine, and then switch sides. We'll want to inhale when we lengthen, and then exhale when we switch to the other side. And again, if this is tolerated, if it's not going to aggravate the sciatic symptoms, we can do that 10 times. And that movement and then strengthening is going to help stabilize the lumbar area. So if you can progress from pelvic tilts to reverse crunches, reclined twists to resisted reclined twists, and then to bird dog. Those are 3 foundational exercises that are going to provide some nice lumbar stabilization and hopefully prevent recurrence of sciatica. If you found this information helpful, please share it with your friends. This is Nancy Thompson, your functional fitness specialist at the Springfield Wellness Center.
The third and probably the most important thing when it comes to sciatica is going to be any sort of disc issue. So the table that we have here in the office is called the decompression table. And so what this does is trying to decompress the area of any sort of disc bulge or disc herniation. So I'm going to show you real quickly what a normal healthy disc would look like. So this is the nucleus of the disc, and these are the fibers that hold it in place. When you bend forward, this nucleus pushes back. When you bend backwards, it pushes forward. When you go to the left, it goes to the right, and right to left. So this is what a healthy disc would be doing and looking like, and it's nice and full and hydrated. When these discs start to become dehydrated, they start to get thinner. These fibers start to become more weak, and they're more susceptible to tearing. When they tear, the nucleus starts to push towards the outside. It takes the path of least resistance because it's a gelatinous material. What we don't want to happen is for this to happen where it actually ruptures and comes outside of the disc. That's called a herniation, and that's when it becomes a lot harder to treat. So when we're in the disc bulge stage, which most people are when we see them, what's going on is that the disc is bulged and it's pressing backwards against the nerve. That nerve then comes out of the spine like we talked about and goes into the sciatic nerve, and that's why you feel pain down into the leg. So what this table does is it actually pulls and then relaxes, and it pulls and relaxes, and the table actually opens up underneath the patient, and it gives it a really good stretch. It's gentle, but you can feel it pulling. And these hold your body in place so you don't go sliding down the table, and the pull comes from the machine at the foot of the table. And what that back and forth motion does is it actually creates a negative pressure inside of the disc. That negative pressure starts to pull the bulge back away from the nerve and back into its place. So if we can do the stretches and the exercises to help strengthen around the spine, as well as the adjustment and the decompression table, that gives us our best chance to eliminate that sciatic pain quickly. So if you know anyone that has sciatic problems, or if you're dealing with them yourself, make sure you like this video, and if you have someone that you know could benefit from it, make sure you share it with them or tag them in the comments below. If you have any questions about sciatica or what we can do here in the office for you, give us a call at 726-0422 or visit us online at wellnessspringfield.com, and we will see you next week.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.